Finishing ATI, Chapter 26, Respiratory Failure. Another therapeutic procedure would be kinetic therapy. A kinetic bed that rotates laterally which will alter the client positioning to reduce atelectasis, collapsed lungs, and to improve ventilation. Kinetic therapy. Nursing actions would be to begin slowly and gradually to increase the degree of rotation as tolerated. Monitor ECG, SaO2, breath sounds, and blood pressure. Stop rotation if the client becomes distressed. Provide routine skin care to prevent breakdown. Sedate as needed. Complications could include endotracheal tube, trauma during intubation or long-term intubation can cause damage to trachea and vocal cords. A tracheostomy might be required for long-term ventilation. Altered position of endotracheal tube. Nursing actions would be to check tube positioning every 1 to 2 hours and as needed. Assess lung sounds, SaO2, and chest movement each time the client is moved, transferred, or turned. Secure endotracheal tube per facility guidelines to maintain tube placement. Aspiration pneumonia is another complication that could occur. Nursing actions would be to check the cuff on the endotracheal tube for leaks. Assess suction contents for gastric secretions. And verify NG tube placement. Infection can occur. Nursing actions are to prevent infection by using proper hand hygiene and suctioning technique. Assess color, amount, and consistency of secretions. Blocked endotracheal tube indicated by high pressure alarm on ventilator. Nursing actions are to suction secretions to relieve a mucus plug or insert an oral airway to prevent biting on the tube. Mechanical ventilation. Increased intrathoracic pressure is another complication. PEEP increases intrathoracic pressure, which can cause a decreased blood return to the heart, decreased cardiac output, and or hypotension. Decreased cardiac output can activate the renin-angiotensin-aldosterone system that leads to fluid retention and or decreased urine output. Nursing actions would be to monitor INO, weight, and hydration status. Client education would be to avoid using the Valsalva maneuver, which is straining with ball movement, because it can further increase intrathoracic pressure. Barotrauma, ventilation with positive pressure causes damage to the lungs. Pneumothorax, subcutaneous emphysema, subcutaneous emphysema, barotrauma. Nursing actions would be to monitor oxygenation status and chest x-ray, assess for subcutaneous emphysema, crackles and or air movement felt under skin, monitor for high-pressure ventilator alarms, which can indicate pneumothorax. Immobilization, another complication, can result in muscle atrophy, pneumonia, and pressure injury. Nursing actions would be to position, reposition, and suction every 2 hours and as needed. Provide routine skin care and implement range of motion exercises to prevent muscle atrophy. Complete the active learning scenarios and application exercises in Chapter 26 before exam.